Your feet may be revealing a silent health problem long before most people notice it. Tingling, numbness, unusual dryness, or even small wounds that won't heal could be early warning signs of diabetes. Watch until the end, because recognizing these signals early could protect your nerves, your circulation, and even your life. I'm Dr. Barbara, and today I want to talk to you about something most people overlook every single day: your feet. They carry you through life, step by step, year after year. Yet for many seniors, the feet can quietly reveal serious health problems long before other symptoms appear. One of the most important conditions your feet can signal is diabetes. Diabetes doesn't always begin with dramatic symptoms. In fact, many people live with rising blood sugar for years without realizing it. But while the condition may remain hidden inside the body, the nerves, blood vessels, and skin in your feet often begin to show subtle changes. These signs can appear long before a diagnosis is made. Your feet are uniquely vulnerable because they sit at the furthest point from your heart. Blood must travel a long distance to nourish the nerves and tissues there. When blood sugar levels stay elevated over time, the delicate blood vessels and nerves in the feet are often the first to suffer damage. That's why doctors frequently examine the feet when assessing a patient's metabolic health. One of the earliest warning signs is a strange tingling sensation. Some people describe it as pins and needles, while others feel a gentle buzzing or crawling sensation under the skin. At first it may come and go, appearing mostly at night or after long periods of sitting. But over time, that sensation can become more persistent. This tingling occurs because high blood sugar can damage the tiny nerves responsible for sensation. When these nerves become irritated or weakened, they send abnormal signals to the brain. What you feel as tingling is often the nervous system's first cry for help. Another early sign is numbness. Unlike tingling, numbness feels like a loss of sensation. You may notice that your feet feel dull or less responsive. Perhaps you step on something small and barely feel it, or the soles of your feet seem strangely disconnected from the ground. This numbness can be dangerous because it reduces your ability to detect injuries. A small cut, blister, or sore might go unnoticed for days. In people with diabetes, even minor wounds can take longer to heal, which increases the risk of infection. Dry skin on the feet is another common signal. While dry skin can occur for many reasons, diabetes often interferes with the body's natural ability to keep the skin properly hydrated. The nerves that control sweat glands may become impaired, leaving the skin dry, cracked, and vulnerable. You may notice rough patches, peeling skin, or small cracks around the heels. These cracks may seem harmless at first, but they create openings where bacteria can enter. Over time, untreated dryness can lead to painful fissures that make walking uncomfortable. Another subtle change involves the color of the feet. Healthy circulation keeps the skin tone relatively consistent, but poor blood flow can cause unusual changes. Some people notice their feet becoming pale, bluish, or even reddish at times. This happens because diabetes can damage the blood vessels responsible for delivering oxygen and nutrients. When circulation is reduced, tissues struggle to maintain normal color and temperature. The feet may also feel colder than usual, even in a warm room. Swelling in the feet or ankles can also appear as an early warning sign. When blood sugar affects circulation and kidney function, fluid can accumulate in the lower extremities. You might notice your socks leaving deeper marks than usual, or your shoes feeling tighter by the end of the day. While occasional swelling can occur from standing or sitting too long, persistent swelling deserves attention. It may indicate that the body is struggling to regulate fluid balance properly. Slow healing wounds are another critical signal. A small blister or scratch on the foot should normally heal within a few days. But when blood sugar is elevated, the body's natural repair mechanisms slow down. Blood vessels become less efficient at delivering oxygen and nutrients needed for healing. As a result, wounds may remain open longer than expected. Some may even become infected, especially if numbness prevents you from noticing them early. This is why regular foot checks are essential for anyone concerned about diabetes. Another change some people notice is burning pain in the feet. Unlike tingling, burning can feel intense and uncomfortable, especially at night. Some describe it as walking on hot sand or feeling warmth radiating through the soles. This burning sensation is another form of nerve irritation. When nerves are damaged by prolonged exposure to high glucose levels, they can misfire and produce abnormal pain signals. Thickened or yellowing toenails may also appear. Fungal infections thrive when circulation is poor and blood sugar levels are elevated. Nails may become brittle, discolored, or difficult to trim. These infections might seem cosmetic at first, but they reflect changes in the body's immune response. When the immune system is stressed by metabolic imbalance, it becomes harder to fight off common fungi and bacteria. One of the most overlooked signs is a gradual change in foot shape or pressure points. As nerves weaken, muscles in the feet may lose strength and coordination. This can alter how weight is distributed when walking. Over time, this may lead to calluses forming in unusual places or areas of the foot becoming more sensitive to pressure. These changes can increase the risk of ulcers if not addressed early. Many seniors assume these symptoms are simply part of aging, but in reality they are often early warnings that the body's blood sugar regulation is struggling. Recognizing these signs early gives you a powerful advantage. The earlier diabetes is identified, the easier it is to manage. Lifestyle changes, improved nutrition, regular movement, and proper medical guidance can dramatically slow or even prevent serious complications. Your feet are not just a part of your body that carries you forward, they are also messengers. They reveal what is happening deep inside your circulation, your nerves, and your metabolism. And the next part will explore several additional warning signs that can appear in the feet, including symptoms many people ignore until the condition becomes more serious. Understanding these signals could help you recognize a problem early and take action before permanent damage occurs. As we continue, I want you to remember something very important. The body rarely develops a serious condition without sending warning signals first. The challenge is that many of these signals are subtle, easy to ignore, or mistaken for normal aging. When it comes to diabetes, the feet often become one of the earliest places where these signals appear. Another sign many seniors notice is unusual sensitivity in the feet. While some people experience numbness, others experience the opposite. The feet may become extremely sensitive to touch. Something as simple as the fabric of a bedsheet brushing against your toes may suddenly feel irritating or uncomfortable. This happens because damaged nerves can behave unpredictably. Instead of transmitting normal signals, they may exaggerate sensations. What should feel neutral may suddenly feel painful or overwhelming. This condition is often referred to as nerve hypersensitivity, and it can be an early sign that the nerves are under stress from elevated blood sugar. Some individuals also begin to notice sharp or stabbing pains in their feet. These pains may come suddenly and disappear just as quickly. They might occur during the night when the body is resting or after periods of inactivity. These sharp sensations occur because damaged nerves can send irregular electrical impulses to the brain. It's almost like static on a radio signal. Instead of clear communication, the nervous system produces distorted sensations that the brain interprets as pain. Another warning sign involves temperature changes in the feet. Many seniors with developing blood sugar issues notice that their feet feel unusually cold, even when the rest of their body feels comfortable. In some cases, the opposite may happen and the feet may feel unusually warm or burning. Temperature irregularities are often linked to circulation problems. When blood vessels become damaged or narrowed, they cannot deliver warm, oxygen-rich blood efficiently. The result is feet that feel cold, pale, and sluggish. A particularly important sign to watch for is loss of balance. Your feet contain thousands of nerve endings that help your brain understand where your body is positioned in space. This is known as proprioception. When these nerves become damaged, Your brain receives weaker signals about your body's position. You may feel slightly unsteady while walking, especially in dim lighting or on uneven surfaces. Some seniors describe this as feeling like they are walking on soft cushions or thick socks even when they are barefoot. Changes in foot odor can also occur. This might sound surprising, but when diabetes affects sweat glands and circulation, the natural environment of the skin changes. Bacteria and fungi may grow more easily, producing unusual or persistent odors. In addition, you might notice increased callus formation on certain parts of your feet. Calluses develop when pressure is repeatedly applied to specific areas. But when nerve damage alters how your foot distributes weight, pressure points shift. Over time, these pressure points can cause thicker calluses that become uncomfortable or even painful. If left untreated, the skin beneath these calluses may break down and form ulcers. Another sign some people experience is a slow loss of hair on the toes and lower legs. Hair follicles depend on good circulation. When blood flow decreases due to vascular damage, the follicles receive less oxygen and nutrients. The result may be thinning or disappearing hair in the lower legs and toes. While this might seem like a minor cosmetic change, it can actually signal deeper circulation problems related to diabetes. You may also notice that your toenails grow more slowly or become brittle. Nails depend on healthy blood supply to grow properly. When circulation is impaired, nail growth can slow down or become irregular. Some seniors even observe small dark spots or discolorations on the skin of their feet. These may result from tiny blood vessels becoming damaged. Although they may appear harmless, they can be an indication that the vascular system is under stress. A symptom that deserves special attention is itching. Persistent itching on the feet or ankles can sometimes indicate nerve irritation or skin changes related to blood sugar imbalance. When skin becomes dry and circulation decreases, the nerves in the skin may produce itching sensations. Many people try to treat the itching with creams or lotions, not realizing the root cause may be internal rather than external. Perhaps the most concerning sign is the appearance of small sores or ulcers that refuse to heal. Even a tiny blister can become a serious issue when circulation and nerve function are compromised. Without adequate blood flow, the immune system struggles to fight bacteria. Without proper nerve sensation, injuries may go unnoticed until they become more severe. This is why doctors strongly encourage seniors to inspect their feet regularly. A quick daily check can reveal cuts, redness, swelling, or pressure points before they develop into serious problems. You may be wondering why the feet are so vulnerable in diabetes compared to other parts of the body. The answer lies in both distance and gravity. Blood must travel a long path downward to reach the feet and then fight gravity to return to the heart. When blood vessels and nerves are healthy, this process happens smoothly. But when blood sugar remains elevated for long periods, the delicate structures that manage circulation and nerve signaling begin to weaken. This is why prevention and early awareness are so powerful. The earlier these signs are recognized, the more effectively the condition can be managed. Simple steps such as maintaining healthy blood sugar levels, staying physically active, eating balanced meals, and keeping the feet clean and moisturized can protect both nerves and circulation. Footwear also plays a critical role. Shoes that fit properly help distribute pressure evenly across the foot, preventing areas of excessive stress. Tight or poorly fitted shoes can create friction that leads to blisters and ulcers. Another helpful habit is gentle foot movement throughout the day. Flexing the toes, rotating the ankles, and taking short walks can stimulate blood flow and support the muscles that help pump blood back toward the heart. Even hydration matters. Proper fluid intake helps maintain healthy blood viscosity, allowing blood to circulate more easily through tiny vessels in the feet. All of these small habits work together to protect the delicate network of nerves and blood vessels that keep your feet healthy. Your feet may seem far away from your heart and brain, but in reality they are deeply connected to your overall health. They reflect the state of your circulation, your nerves, and your metabolic balance. In the final part, we will discuss what steps you can take if you notice any of these warning signs and how simple daily habits can protect your feet, your nerves, and your long-term health even after 60. If you've noticed any of the warning signs we've discussed, tingling, numbness, burning sensations, slow healing wounds, unusual dryness, swelling, or changes in the color or temperature of your feet, the most important thing you can do is take those signals seriously. Your feet are not just telling you something about your comfort, they may be revealing important information about your blood sugar, circulation, and nerve health. The first step is awareness. Many seniors rarely look closely at their feet, especially if they are not experiencing pain, but pain is not always present when nerve damage begins. In fact, one of the most dangerous aspects of diabetes-related nerve problems is that sensation can slowly fade without obvious discomfort. That's why a simple daily habit can make a powerful difference. Take a moment each day, perhaps in the morning or before bed, to check your feet. Look at the tops, the soles, the heels, and the areas between your toes. Pay attention to redness, swelling, cuts, blisters, or changes in skin texture. Even small changes can provide valuable clues. A tiny crack in the skin, a new callus, or a blister from a shoe that fits poorly may not seem important at first. But when circulation and nerve sensitivity are reduced, these small issues can become larger problems if left untreated. Keeping your feet clean and well moisturized is another important step. Gentle washing with warm water and mild soap helps remove bacteria and keeps the skin healthy. After washing, drying carefully between the toes helps prevent fungal growth. Moisturizing the skin of the feet can also prevent dryness and cracking. When the skin stays soft and flexible, it becomes more resistant to injury. Just remember to avoid applying moisturizer between the toes, as excessive moisture there can encourage fungal infections. Proper footwear is equally important. Shoes should fit comfortably without squeezing or rubbing against the skin. Tight shoes can restrict circulation, while loose shoes can create friction that leads to blisters. Soft, supportive shoes that allow your toes to move naturally can protect your feet throughout the day. Socks matter too. Breathable fabrics help reduce moisture buildup, while seamless designs can prevent irritation against sensitive skin. Movement is another powerful tool for protecting your feet and improving circulation. When you walk, stretch, or gently flex your ankles and toes, the muscles in your legs act like pumps that push blood back toward the heart. This improves oxygen delivery to the tissues in your feet and helps keep nerves healthy. Even simple movements throughout the day can make a difference. Rotating your ankles, flexing your toes, or taking short walks every hour can stimulate blood flow and prevent stagnation in the lower legs. Nutrition also plays a crucial role. Balanced meals that support healthy blood sugar levels help protect both nerves and blood vessels. Foods rich in fiber, healthy fats, and antioxidants support the body's ability to regulate glucose and reduce inflammation. Hydration is another often overlooked factor. Drinking enough water helps keep blood circulating efficiently through the body's smallest vessels. When blood flows easily, the tissues in your feet receive the oxygen and nutrients they need to remain healthy. If you notice persistent symptoms such as numbness, burning pain, or wounds that do not heal within a few days, it is important to consult a healthcare professional. Early evaluation can help identify whether blood sugar levels, circulation problems, or nerve damage are contributing to the symptoms. Testing for blood sugar levels is a simple step that can provide valuable information. Many people discover diabetes during routine medical checks after noticing subtle symptoms like those we've discussed. The good news is that when diabetes is detected early, it can often be managed very effectively. Lifestyle changes, proper medical care, and consistent monitoring can help prevent serious complications and protect long-term health. It's also important to remember that not every foot symptom automatically means diabetes. Many conditions, from circulation problems to vitamin deficiencies, can cause similar sensations. But the key message is that these symptoms deserve attention rather than dismissal. Your feet serve as early messengers. They reveal changes happening deep within the body's nervous system and circulatory network. By listening to these signals and responding early, you give yourself the best chance to protect your health and maintain your independence. Healthy feet allow you to walk confidently, stay active, and continue enjoying the activities that bring meaning to your life. Taking a few moments each day to care for them is a small investment with enormous long-term rewards. So if your feet are sending signals, whether it's tingling, numbness, unusual dryness, or wounds that won't heal, don't ignore them. Those signals may be your body's way of asking for attention, balance, and care. And the earlier you respond, the easier it becomes to protect your nerves, your circulation, and your overall well-being for many years to come.